Good morning, everyone.
Good morning.
Yeah, oh, you can hear me. Good. Good morning.
Good morning.
We're going to start in 5 minutes. All right. Always have to go back to where's the chat? Where's my PowerPoint? All that kind of stuff.
Do you know if Dr. Gabriel rescheduled the test taking tips yet?
You mean our little review that we have of the exam?
She was supposed to do, she tried to do like a presentation of test taking strategies, but
No, I'm thinking of something else. I don't know about that. She was going to post something for you guys?
Oh, okay.
No. Is that what you're telling me?
Yeah, I was just wondering if you knew anything about it.
I don't know anything, but we are going to have a meeting after this. And usually she comes to the meeting so I can ask her.
Okay, thank you.
All right, I'm having trouble here. Why is this? We need a couple more students. So this is a really important topic to attend class for today, because I feel like my goal is to, good morning, Christina, is to get you to understand this, hopefully, so that you understand it. And it's a pretty difficult topic, but you know, and I'm not going to share it yet. Well, I guess we could share it. Can you guys see me in the corner, or see me at all if I have the power?
Yes.
Oh, you can see me in the corner. Okay,
Yeah.
because I want to do our 2 minutes of exercise or our 1 minute when we start out. Not that you need to see me, but I just want you to see what I'm doing so that you can follow along and do a little bit of that too. So good morning, everyone. I see everyone. I'm seeing you all join, which is great. I can't see how many are here. I want to try to get everybody here because, like I said, this can be very confusing. Some people think of this as chemistry. Kind of is a little bit like chemistry. And I'm going to tell you the important parts, what you really need to focus on and what you don't need to focus on. Yeah, obviously, I want you to have an understanding of it. So I want you to focus on a lot of it. But I'll kind of tell you the important parts. The important parts are not the chemistry parts. So simple nursing for this topic is awesome. All right. I'm always just trying to get, it's on YouTube. It's on YouTube. If you feel like you need further clarification, absolutely, whatever you feel you need, you know, feel free to ask me questions as well. I'm going to go over it, and I'd like you to kind of stick with my PowerPoints and things. I know that we had a question in, Ryan, was your question from NCLEX review? Was it from, or the NCLEX questions, or was it the dynamic study module? But anyway, it was incorrect. So I feel like sometimes, no, it was the module, the dynamic study module. Yeah, I feel like sometimes those questions might not be accurate. And so he sent me, I don't know if you saw my explanation this morning. We're going to talk about it today. And if you have any further questions, please feel free to let me know, of course. You see mistakes all the time. I know. I know. I know. We all agree. Okay. So let's get started. Good morning, everyone. So excited to be back here this morning. We're going to be talking about acid-base balance. But before we do that, we're just going to warm up our bodies just a little bit because you're going to be sitting for almost 2 hours. Really important to try to pay attention. Don't just put me on in the background and walk away. Really stay focused and stick with the slides I'm going to show you today and ask any questions that you have along the way so that you don't get lost. I'm going to try to make it as simple and easy as I can. Okay, the first thing we're going to do is we're going to get up and we're going to march in place. Okay, everybody march in place. Move my chair out of the way. Everybody up? I hope so. You should be able to text me and answer me, or not text me, chat with me because you're up walking. Okay, now we're going to do butt kicks. Bring your leg back. We're going to do a butt kick. Okay, we're going to do a few of these. Everybody doing it? I hope. Okay, now we're going to do some side reaches. We're going to reach over our heads. Do a few of these. And if you can do jumping jacks, now we're going to do 10 jumping jacks. 3, 4, 5, 6, 7, 8, 9, 10. Okay, a few squats. 1, 2, 3, 4. Knees behind your toes. 7, 8, 9, 10. Okay. Now we are going to reach up, touch the floor, back up, touch the floor, back up, touch the floor. Now we're going to take a nice deep breath and up above our head. Another deep breath and one more, and then we're going to start. Okay. Everybody getting our respiratory rate up a little bit? I hope so. Mine's up just a little bit. We're going to be talking about this. As we start to breathe heavier, what condition are we in? And our heart rate. Yes, our respiratory rate and our heart rate. But today we are primarily going to be
Would that be alkalosis?
If we were to continue, Nicole, yes. If we were to keep and almost to the point of hyperventilating, we would be in respiratory alkalosis. Great. Some of you guys have been preparing. So excited. Okay, I'm going to take you through it step by step. So first, you can see my screen, correct? I got to get my pointer out too. Yes. Okay, thanks. Okay. How many people are in the session? I don't know why I cannot see that. Oh, 101. I can
101.
see. Yeah, okay. So we're missing some. Their loss. Okay. So we start with acid-base balance. I always like to start, with the outcomes. What are the outcomes? So what is acid-base balance? It's about the acids and the bases in our body being in balance. So important for them to be in a certain range. And our body regulates it. So if it finds that, oh my goodness, I'm out of breath, there are certain things that we can do to try to compensate for it. And some of the outcomes, the positive outcomes, are that you're going to have normal baseline level of consciousness, because eventually it can affect your level of consciousness, the negative outcomes, and eventually death. But the positive outcomes, you're going to have non-labored respirations, normal activity for your age, balanced acid and base production. And that's our goal. Negative outcomes can be that we can end up with changes in level of consciousness, cardiac arrhythmias, then it's going to affect our heart, anxiety, vomiting, diarrhea, cellular destruction, and then death. You can also have tetany, tingling of the extremities, and seizures. Here are our objectives. We are primarily going to be focusing on the exemplars for this topic are metabolic and respiratory alkalosis. However, with that said, I find it impossible to teach this topic without talking about metabolic acidosis and respiratory acidosis because they all go together. Okay, see this slide right here? You need to memorize this. I think most of you have this memorized. You've learned it. Do you guys know this? You know what the normal pH is. I think most of you know that. Yes, okay, you should have learned that like in chemistry, right? So normal pH is 7 point, this is blood pH. Yes, Naveed, yes, 7.35 to 7.45. You absolutely need to know this. If you do not know this, you're going to get every single one of my test questions wrong, okay? And any question related to acid base. So please memorize this. But beyond memorizing what 7.35 and 7.45 are, you need to know that if a patient's pH, blood pH, is less than 7.35, they are going to have an abundance of acid on board. And if it's higher, they're going to be in a state of having a lot of bases on board. So 7.46, 7.47, 7.5, that's a situation of where there's a lot of base on board. And we call that alkaline, right? And if it's excessive amounts, it's called alkalosis. Excessive amounts of acid are called acidosis. Now, you all learned the term diabetic ketoacidosis, correct? And we're talking about diabetes. That I'm correct, right? I think you all learned about DKA. Yep. Okay, good. Thanks. Okay. So this is where the acidosis piece comes in. Certain things can happen where your body is trying to adapt, but what is happening, we're going to talk a little bit about DKA. Your body starts to go into a situation where there's too much acid on board and your pH becomes higher or lower than the range. If you're in a state of acidosis, lower, excellent. And this is where you have to stay with me with this, okay? So if you are in a state of acidosis, your pH would be somewhere in the range of 7.3, 7.31, 7.32, 7.34, somewhere in there, okay? Now we are going to talk about normal PaCO2. That's our partial pressure. And we see the A, this is arterial. Remember, we have the arterial system and the venous system. To get a true reading of someone's pH, you want to look at the arterial levels, okay? What is the arterial blood draw, not venous? You're going to see, bicarb, HCO3. You're going to see that in blood work. That's venous. But respiratory therapists are trained to do arterial blood gases. So these are called ABGs or arterial blood gases. And you're going to see a range, if somebody has it drawn, of what is normal, what is the normal CO2. And you want to think of, whenever you think of CO2, which is what? Carbon dioxide, think of acid. Okay, anytime we talk about CO2, you're going to think about acid and you're going to think about respiratory system. Okay, we all know CO2, respirations, right? Respiratory acid. So I can't state this enough. Anytime you see CO2, you're going to think acid and you're going to think respiratory system. Okay. The next thing you need to memorize are these numbers right here, 35 to 45. So you know what's really easy? You all already know what the normal pH is, right? 7.35 to 7.45. Just take away the 7 point. And you've got 3.5 and 4.5. And that is for your CO2, millimeters of mercury. With that said, what happens? Yeah, I know. We need all these little simple, thanks, Sandy. We need all these little simple ways to associate and remember. That's how I try to, it just helps you memorize things. Okay, and right now we're talking about you're going to have to memorize. In the past, we had a short little, I was able to do a short little class, like, I don't know, I think it was less than an hour. I think it was after an exam or something. But anyway, I was able to give you like the basics of having to memorize this. And then we go on. But anyway, we just have today, which will be fine. So memorize these numbers. Now, with that said, the more CO2 we have, what did I tell you? Think of CO2 as acid. CO2, acid, respiratory. If we have 46, 47, 48, is that in the direction of even more acid, or is it going to go down to base? Yes, it's going to be acidic. Excellent. Okay. So the higher the CO2, the acid, this number is going to go up. So when you see a number of 50, you're going to think, wow, that person is in a state of acidosis and possibly respiratory acidosis. Okay, I say possibly, there's another piece to this. Okay, now, if their CO2 is less than 35, they don't have a lot of acids on board. Their CO2 is going to be 30, 31, 29, 27, anything less than 35, they're going to be in a state of alkalosis. Okay? Any questions so far?
Yes, I have a question. You said to think acid, right, with CO2. So if there's an excessive amount of CO2, then it's acidosis. And obviously, if it's lower, then it's alkalosis. Is that it's because of a lack of CO2, not or a lack, an increase or decrease in acid, not an increase in bases, right? That it would drop lower.
It's because of an increase. You can have a lack of base, which is going to make your acid go up. I'm going to show you a scale in a couple of minutes.
Got it. So if the CO2 drops below 35, it's not alkalosis because of excessive bases. It's alkalosis because of lack of acid. Does that make sense, or am I just making this more confusing?
Yeah, I don't want, right. So you know what? Hold that right now. Is this Ryan?
Yeah.
Yeah. Okay, Ryan, hold that right now, because I don't want anybody else to get confused with it. Because I'm going to keep doing a few more slides, and I hope that it's going to help you understand. If the acid goes up, the base is going to go down. Okay, so if you have a lack of base, you can have an excess of acid. It's a balance. There's a scale coming up in a short while, and you'll see that.
Sure. Thank you. Yep.
Okay, sure. Now we have our normal HCO3. Okay, wait, hold on one second. Okay, so you need to memorize this level for bicarb. And this is the abbreviation, HCO3, it's bicarb. This is opposite the CO2, right? The CO2, what was normal, do I have the right slide up? Yeah, okay. I'm looking at two different PowerPoints at the same time because I have my notes in another one. So I just want to make sure that I'm on the same page with you guys. Okay, so we have 22 now, 22 to 26. By the way, the book uses like 24 to 28. Don't worry, it's going to be obvious. Okay, I'm not going to have it be like, 23. And any laboratory result I have ever seen, bicarb is 22 to 26. Okay, and I don't want to, make my judgments about Pearson. I'm not a fan. Okay, I guess I just did. But this book, I have never seen any other lab results for bicarb to be 24 to 28. It's always been 22 to 26. That's what I've always known it to be. But don't worry, I'm not going to give you a level of like, 27 or where it's going to be on the border. It's going to obviously be in either direction. Okay. So no worries about that for the test. So bicarb 22 to 26. Okay. That is the normal range. Now, if it's 27, 28, 29, 30, 33, is there an excess of bicarb or an excess of acid?
Bicarb.
Bicarb, exactly. Base. Good. Okay. And the same is true on the other way. So you have to know which direction it's going in. Anything less than 21 is going to be more acid. Anything greater than 26 is going to be more basic. Okay, we got that. Great. Next, now this is a tiny bit of chemistry for the exam. Everybody's always worried about the exam. You're not going to be asked about hydrogen ions, electrons, and protons, okay? I think you all kind of have the gist of our test questions for the most part now, which are about what is the nurse going to do for a patient who might be in respiratory acidosis. That you need to know. What will the nurse do if they have a client in respiratory? Well, there's not always so much first things. I guess they're kind of like first, but it's more of, what are some of the things that we are going to do for these patients? What might be causing these things to happen? But I am going to take you through a basic little bit on how this all comes into play, because it might help you understand it a little bit more. If you don't understand this part, not a huge worry, okay? So acid-base balance is so important because it's critical to maintain homeostasis in regular cellular function. What is homeostasis? Remember learning that in biology? I'm sure you did. Homeo,
Equal.
balance. Go ahead. So, did someone want to say something?
Oh, no, I was just saying it means like they're equal. Like balance would be a really good word for that.
Exactly. Balance. Homeo means the same, and stasis means steady, right? They're Greek words, actually. So there's a very narrow window. I mean, narrow. This is the window of homeostasis. Anything outside of it, higher or lower, a patient can die. So this is how we maintain homeostasis. And with acid base, it has to do with hydrogen ions. When you think of hydrogen is basically neutral, but hydrogen ion has a positive charge. You don't need to know that. The pH indicates the concentration of the hydrogen ions. When you think hydrogen ions, think acid. If you want to go to hydrogen ions, there's going to be nothing on the exam about hydrogen ions. Okay, so don't get worked up. I don't understand this hydrogen ion stuff. And hydrogen concentration is measured as the pH. I'm sorry, can you hear it? I thought I was on. What the heck? I'm on, my phone is on vibrate, but you must hear the ringing through my computer, I guess, right? Okay. Where are we? Do you hear that? Because it's very distracting to me.
Yes.
Yes, you can. I know. And I have my phone on vibrate. What do you think? I don't know what's up with that. Maybe I have my phone plugged in. Maybe that's it. I have a MacBook. Yes, I do. Okay, let's keep going. So hydrogen ions, think acid. Okay, so hydrogen ion concentration indicates the pH. Hydrogen ion concentration and pH are inverse. So as the hydrogen ion concentration increases and becomes more acid, remember I said, think hydrogen ions, think acid, the pH is going to come down, right? It's going to be less than 7.35. As the hydrogen ion concentration comes down, the pH is going to go up. Okay, so here we have the blood pH. the blood pH is going to determine whether the substance is acid or basic, right? We talked about that in the beginning. So the body maintains the blood pH within that normal range, 7.35 to 7.45. And pH 7 is neutral, right? So 7 is neutral. So normal blood pH, just an FYI, is slightly basic. Because the 7 is neutral and we are right smack in the middle, 7.4 is right smack in the middle, which hopefully is where our pH is for all of us. We would be 7.4. If we were 7.3, maybe even 7.35 or 7.34, that's how tight it is. We would probably be in the hospital right now. Okay, so most of us are right around 7.4, definitely in this range. So alkalosis, okay, as this gets higher and higher and higher, it's more basic. As it gets lower and lower and lower, it's more acidic. I think we all established that. And that's just so important to know. That's why I keep going over it. Okay, the buffer system. The buffer system. The buffers are substances in the blood that help keep the pH in normal range. So when it starts to go out of range, the kidneys say, hey, wait a minute, let me do something. Or the lungs say, let me do something. So the good news is that the lungs can restore the pH to a normal level within about 15 minutes. The kidneys take a lot longer. The kidneys are slugs. I'm only kidding. They take 2 to 3 days, where the lungs, they kick right into action immediately. So how do they do that? They do that by, this is called our buffer system. And the buffers are going to bind to the hydrogen, or they're going to release the hydrogen ions to prevent the change. So the buffers act quickly, but they're limited. They can only do so much. If the body fluids become too basic, the buffers are going to release hydrogen ions to lower the pH. All right. If the body fluids become too acidic, the buffers are going to bind with the hydrogen ions to increase the pH. Did the kidneys release the bicarb to concentrate, to compensate? Yes. So the kidneys, when we think kidneys, we are going to be thinking bicarb. When we think respirations, we're going to be thinking lungs. Okay, so the kidneys work on the bicarb, and the lungs work lungs and CO2 work together. So what happens here to maintain homeostasis? You do not have to know this slide. The CO2 soaks up, it adds and combines with water, and it gets to carbonic acid. All right. And then when you have the carbonic acid, if it releases the hydrogen ions, it's going to become more basic. So it goes back and forth to the lungs, and it maintains its homeostasis in that regard. So another thing I wanted to mention when we
I'm sorry,
talk
Professor, do we need to memorize like the non-volatile and the volatile ones, or? Okay.
No, it's not even in my PowerPoint. Nothing to do with the volatile and non-volatile. You do not have to know that. This is, by the way, this is the introduction to acid-base balance. Next year, senior level, you're going to get part 2, which is more of the acidosis part. But like I said, there's no way for me to teach this without giving you the whole shebang. So next year, you're going to learn all of it basically again. And my students in the senior level, they all say that they learned it in this level quite well, so that it was just a refresher when they got to senior year. They kind of still remembered it was just a refresher. Okay, normal acid-base balance. The body continuously produces acid, and we have 3 body systems that work together to maintain. What are the 3 systems? I told you about the respiratory system, the lungs. They're going to try to do their thing, and they're faster than the kidneys. They're like 15 minutes. The kidneys, they take 2 to 3 days. And then those buffer systems in the middle. Okay, so the buffer system, they compensate. So when your body starts to get into trouble and it starts to go too basic, or like you're vomiting and you're losing hydrochloric acid, right? What's in our stomachs? Hydrochloric acid. pH, what's the pH of stomach? Are the lungs and kidneys included in the buffer system? No, they're separate, James. They're 3 separate systems. Yeah, it's around 1 to 3, Naveed, good. Okay, so acid in the stomach, we start vomiting, we're losing our acids. And so, you know, our body's going to say, hey, wait a minute, I got to do something. I don't want to lose all this acid, because if I start losing too much, I'm going to get into trouble. My body, I'm going to end up in the hospital. And I have to have, the body is going to immediately try to compensate as best it can. It might need some additional help, like medicine and things like that, IV fluids, different things that we can do. But just know that the body wants to try to compensate. Just know that. And you're probably seeing it all in the readings and everywhere. Okay, this slide. This is a scale. Everything has to be in balance to maintain the homeostasis. Here is our normal pH, 7.35 to 7.45. If this goes up, right, we have too much bicarb, all right, we can die. It gets to 8 and we can die. All right. And really this even 6.8 is kind of low. We can even go to like, you know, around 7.1 and a person can die. So what happens if we become too acidotic, like someone who's in ketoacidosis? Okay. What's going to happen? This is going to go up, right? We're going to have a lot of bicarb. This is what I was talking about, Ryan, in the beginning. So as one goes up, the other goes down. So that can start to happen where we have too much. So just keep that in mind. Oh, I wanted to mention, okay, I'll get to that. One of the things that I was going to mention is think about Tums. We all know about Tums. Tums is a little product. It's a little, looks like a little piece of lozenge or something, a little candy. And Tums, what does that do when someone takes the Tums? Probably had it. You've probably given it to patients. It's bicarb. Yeah. Okay. It's basic, right? Because, and why do people take it? Because they have too much stomach acid and it neutralizes the stomach acid. So there you go with the balance. Okay. If we have too much stomach acid, we're producing that, it's really bothering us. We take something to try to compensate for it and try to raise the pH a little bit. We take alkaline, right? We're going to take bicarb or something basic to try to neutralize that acid. Make sense? Okay. So here are the categories. We have in the renal system. So what they do is they form or they excrete bicarbonate, okay, our HCO3, or retain or excrete hydrogen ions. Okay, so this is what they can do. They are going to control and work around the bicarb. So when you think bicarb, think kidneys and think basic. And when we think kidneys, we are going to think about the metabolic situation. Okay, it's metabolic. That's going to indicate a change in the bicarb. Bicarb is metabolic. We can have situations of metabolic, our metabolism, kidneys. All this goes together. Metabolic acidosis, loss of bicarb. Okay, because we have an excess of acid. Metabolic alkalosis is an excess of the bicarb. So this osis is bicarb. Carbonic acid, that's when it combines with the water. So I almost want to tell you to forget the carbonic acid. Pretty much just stick with this. That was kind of the basics. And I know that, you know, that's important, but the body accepts and releases hydrogen ions to make things neutral. Exactly. The CO2 is going to take on the water, accept the water to get to the carbonic acid. Right. Respiratory system. we're going to increase or decrease ventilation in order to blow off or retain CO2. And I'm going to give you some examples of that as we continue. So, so when you think of CO2, you're going to think what? Acid, and you're going to think respiratory. So this is going to cause the carbonic acid to change. Respiratory acidosis, excess. Osis usually means excess. So acidosis is CO2 is retained. The body has too much CO2. Okay, respiratory acidosis, what's in the body? Respiratory alkalosis is CO2 is lost. I'm losing the CO2 and I have an excess of base. Okay, I was going to say bicarb, an excess of bicarb. All right, so when you think respiratory, think CO2 and think respiratory system. Kidneys is metabolic system. So the renal system, the kidneys, will help achieve the normal pH by forming or excreting the bicarb. Okay, it's going to either get more bicarb or it's going to get rid of the hydrogen ions, which is acid. Okay, the respiratory is going to compensate. Is respiratory acidosis always hypoventilating or okay? So I see the questions come through because I have so much up. I can answer that in a minute. Let me just finish because I think if I keep going, you will understand what I'm saying. Respiratory system, hold that question, and if I don't get back to it, ask me again if I don't cover it. Respiratory system is going to compensate. How does the respiratory system compensate? By breathing. Okay, it's either going to increase respirations, okay, blow off our CO2. We're going to get into some examples in a couple minutes, or it's going to decrease ventilations. If someone's breathing too much, like when we finished our morning exercise here, hopefully you did a little more than that. But while we're doing, and we're getting out of breath, what are we going to do? If we keep that going, it's going to be a problem. So I'm going to give you some examples as we continue on. Okay, respiratory compensation mechanism. So what happens here? This is the body's way of correcting respiratory acidosis. So CO2 is an acid, right? Is a potential acid. When combined with water, it forms our carbonic acid. When that CO2 is increased, or we have too much of it in the blood, it's going to stimulate the brain's respiratory center, okay? All right, the lungs are controlled by the brain. Everything's controlled by the brain. And it's going to go up to the brain. It's going to say, hey, wait a minute. We've got too much acid on board. So how can I get rid of this acid? So it's going to say, you need to do something. So what's going to happen? I got too much acid on board. I need to get rid of the CO2. When I exhale, what do I get rid of? CO2. So I need to start exhaling. Exhale. Pick up that respiratory rate and start exhaling. Get rid of that acid. Okay? I need to start increasing both the rate and the depth of the respirations to get rid of that CO2. So what's going to happen as a result? I'm going to have decreased levels of that carbonic acid and the blood, and decreased acid, and the blood is going to become more alkaline. Okay, so let's think about this. So this is the body's way of correcting it. If I have too much acid on board, you might say, how do you get too much acid on board? Okay, I'll tell you how you get too much acid on board. These are COPD patients that cannot take a deep breath and get rid of normal CO2. So right now I'm talking loud here in my dining room. I'm talking very loud to no one but you guys, because I'm talking through the computer. So I want you to hear me. I feel like I'm all alone here talking, and I'm breathing And I'm almost at times, I'm so excited about this topic. I'm almost getting passionate. I'm starting to almost hyperventilate. So, am I building up CO2? No, I'm not building up CO2 because I am breathing. My respiratory rate is up and the depth of my breathing is going. Okay. But if I was to just kind of take a nap, I'm taking a nap, right? And now I got some nice pain medication on board. And what do you think is going to happen to my respiratory rate? It's going to go down. Right. Right. What do opioids do? Opioids decrease your respiratory rate and they depress your central nervous system. Exactly. For breathing. Right. So that is a perfect example. When someone is sleeping and they have morphine, Dilaudid, any kind of opioid on board, or any kind of opioid on board, they can have a buildup of CO2. This is what happens with patients who overdose, right? Okay, what happens to their breathing? Ventilation is different. The machine is breathing for the patient. So ventilators, that's a whole different ballgame. Okay, so what happens when someone has opioids on board and they go into what's starting to happen is they're getting close to respiratory acidosis. They have a lot of CO2 on board that they are not able to get rid of. So if that patient who has a lot of morphine, a lot of CO2, yes, CAPNO. CAPNO means CO2. If that patient has a lot of CO2 on board, what do you think we can do for that patient to get them to, we can give them naloxone, yes. That's if they're out of it. What if they're still with it? What if they're still with it? This is your patient. Yeah, great, Logan. Yes, this is your patient that you're going to have on the night shift. They're going to bed. You've just medicated them. It was always my fear when I worked evenings. They're sleeping. How do I know if they're breathing adequately or not? How do I know if they're going into respiratory acidosis? Okay, well, not when they're sleeping. Okay, but we can. Yeah, okay, Chris, that's good. So you got the right idea. We want to wake them up, shake them, breathe for me. Because if they start taking those nice deep breaths, they are going to be exhaling. What are they going to exhale? What do we exhale? Right now I'm exhaling what? CO2. They're exhaling CO2 and they are getting rid of that buildup of acid. You see that? Okay, another example, I'm going to get through a lot more examples actually. And this is the stuff you need to know for the exam. I don't want you to just memorize it. I want you to understand it so you don't have to memorize it. So if you think about a patient who's had a lot of morphine, you're going to think they have a buildup of CO2 because they're not getting rid of it. They're not taking big breaths. They're lying there and barely breathing. Their respiratory rate might be 5 or 6. So the first thing we're going to do is shake them and get them to wake up. Okay? Wake them up. Wake them up. And then if they're able to wake up, we're going to tell them, take some nice big breaths, Mr. Jones. Come on, Mr. Jones. I need you to give me some nice big breaths. And yeah, then if they can use the incentive spirometer. But right now, just wake them up and get them. That's later, incentive spirometer. Really, the thing to do is just get them. What does the incentive spirometer do? The incentive spirometer gets our patients to take deep breaths because people are not going to go around on their own after surgery and practice that. We give them that toy so that they can give them something to do to practice it. It gets them to do it. We don't necessarily, years ago, we didn't have incentive spirometers. We just got them to just take big breaths. That's where that cough, turn, and deep breathe comes from. We didn't have incentive spirometers. Get them to deep breathe. Get them to get rid of that CO2. Exactly. Coughing does it also, as I just coughed. So that is so important. I want you to think about what is happening, the mechanism, and not just trying to memorize. Then down the road, if they cannot wake up, you cannot arouse them. You can't say, come on, wake up, right? They're unresponsive. CPR, come on, wake up. Then we will go to the naloxone. Absolutely. If we cannot wake them up. If we can wake them up, get them to take some nice deep breaths. CO2 patients also, they have high levels, CO2 patients, COPD patients, COPD patients, they have high levels of CO2 in their blood. And so we want to get them, so release. So sometimes that's a tough one. They can't always take deep breaths. That's why they have this high level of CO2 in their blood. So releasing the hydrogen ions becomes more basic for them. Okay, let's keep going. So now the renal, do hiccups affect pH? I don't think so, Veronica. I never heard about hiccups affecting pH. Certainly gets you to breathe though. Okay, now let's talk about, and if patient had any respiratory depression meds, you would absolutely hold them. You would absolutely hold them. Yes. Or you have to have, if you have an order, this is critical thinking. Am I going to give someone anything? They have an order for morphine, maybe around the clock or something, and they're barely breathing. We're absolutely going to hold it. Absolutely. Okay. Yep. Call the doctor because we're holding it. Hold med. Okay. So renal metabolism. All right. So this responds more slowly. I mentioned that. Kidneys are slugs. No, please don't think that. The renal doctors, Dr. Champy will have my head here. No. So, oops, did I go ahead too much? Yes, I didn't talk about this one. Okay. So what happens in the renal system? Regulate the bicarb levels. So how are they going to regulate the bicarb levels? They are going to excrete or retain the acid, okay, as needed. So acidosis. Acidosis is an excess of acid, right? Hydrogen ions. The kidneys will excrete. They have to get rid of those hydrogen ions. There's too much. So if the body, if it's in the lungs or anywhere in the body, if there's CO2 or whatever it is, the kidneys are going to try to get rid of it. And when they get rid of it, they want to try to increase and retain that bicarb for acidosis. Now, if there's too much bicarb, the kidneys say, hey, wait, remember the scale? I need some acid and I got to get rid of this bicarb. So whatever is lacking, we have to give. You get that? And if we have an excess of something, we have to get rid of it. So think about how can we maintain that homeostasis? What do we need to get rid of if there's too much? Or what do we need to gain if there's too little? And that's really what this is all about. It's about that balance. That sounds simple, right? Not really. Can you measure hydrogen? No, we don't do it with you. So remember at the beginning of this lecture, no, it's, your urine can be, this does not affect, this is really about the blood. So the blood acid base, not about anything else. The stomach, I mentioned the hydrochloric acid in the stomach, that affects your whole body as that happens. And I guess if your urine becomes too acidic or too basic on one end, I guess that could happen. I suppose I never really thought about it, but we really don't look at the urinalysis in that regard. Okay. So categories, this is all I'm just kind of restating this in different ways. Acidosis, hydrogen ion concentration increases and above normal. So the pH goes down. Remember, hydrogen ions, these are acids. So the acids increase, the pH goes down. When the acids go down, we have an increase in the pH and is more alkaline. Correct? Get that? So in acidosis, excessive are present and pH drops. In acidosis, yes, just exactly as the slide says. Sure. Okay, next slide. Okay, so these are the categories. And these categories, hold on. So this has to do with acidosis. Okay, so you can have either metabolic or respiratory, either one. Same thing with alkalosis. You can have either metabolic or respiratory. But remember, I said metabolic has to do with the bicarb. Respiratory, okay, has to do with the carbonic acid or the CO2. Remember, carbonic acid is combined with water. Okay, CO2 plus water equals carbonic acid. So that's the combination or the release of water. So respiratory, you want to think of the CO2 and the water equals carbonic acid. Metabolic, you want to think about the bicarb. All right. So what is acidosis? A pH greater than or less than 7.35. Acidosis, less than. Good. Right. Okay. So anything in acidosis, metabolic or respiratory, the pH, no matter which one, the pH is going to be reflected. It's going to be reflected in the pH, and it's going to be less than 7.35. Now you're going to see alkalosis, and immediately you're going to think pH greater than 7.45. Okay, everybody with me? I think you're with me. Okay, yep, good. Stay with me. It's not going to get too much more complicated. We're almost going to just be doing examples. We want to be looking for true ABGs. They are arterial blood gases. So those of you in clinical this week who have patients who've had blood gases, maybe somebody came in with DKA, they may not do arterial blood gases, but if they were to do arterial blood gases, this is the information it provides. Yeah, this test does hurt. Yes. And they go, because why does it hurt? They go right into the artery, right there, not the veins. They're not going into the anticube into a vein, or like when they start an IV, they're going right here. And it's deep. Yes, it is. It's not fun. And that's why we don't like to do it on patients unless they're critically ill. You know, we're really worried about them. Yeah, I know. That's because they're feeling. That's what they're doing with that hand with the glove. Okay, so it's going to provide you with the pH. The pH is always the first thing we look at. We always start with the pH and we determine right then and there that 7.35 to 7.45. Where is the patient? Are they acidotic or are they alkalotic? Okay, so which one are they? And what if they're like 7.35? What are you going to be thinking? 7.35, what are you going to think? You're going to think acid or you're going to think base? It's in normal range. However, it's close to the acid line. Yes, it's close to the acid line, and maybe the body's starting to compensate and it's starting to come back to normal. So you want to look at it. Yeah, 7.35, that's at the edge. That's at the edge of going off. So not really good. If you've got someone who's 7.35, you're saying, okay, they're normal, but they're not very normal. They're right at the edge of being, having too much acid. Acidosis. Trending, we don't do trends usually with we can in ICU, usually. I mean, if a patient is usually, really that low, most often they might be in ICU. We're doing a lot of things. We don't do these tests too often for the exact reason that Sandy mentioned. It's very painful on the patient. And we're going to be watching for signs and symptoms of recovery. So do we really need to do it again? So trending is not, with everything else, trending, absolutely. I'm all about trending, not so much for ABGs. Okay,
so I guess, do different people have a baseline that varies more acidic or more alkaline, or is pretty much everybody the same?
Pretty much everybody is in that range, yes. Okay. And we want it to be really around, 7.4. We want it really to be, remember, slightly alkaline. That's our normal blood. So hopefully, I think if we took everyone's blood in this, if we had to do ABGs, no thank you. But if we had to, we would all be right around 7.4. So yeah, no, when you look at it, we're looking 7.35, 7.45. They're headed toward basic. Are they coming down? So if a patient is critically ill, we may start to do trending and do another one and keep looking at how they're doing if the patient's not getting better. Yes. The bicarb, we're going to be looking at the CO2, the bicarb, the oxygen, and then the O2 sat. So here are normal blood gas values. I mentioned the first 3. We talked about that in the first 5 minutes. pH in the urine is different. Yes, pH in the urine that's a whole different ball game. Don't even think about pH in the urine, really. Because we've got pH in the intestines, pH in the stomach, pH in the lung, right? All that. But this is blood pH. We are talking about arterial blood gases. I can't stress that enough. Okay, and then our PA, this is our arterial. So the PA is partial pressure, and that means it came from the artery. Okay, partial pressure of oxygen in the arterial blood. You don't have to know about the PaO2 and all that. And whereas the oxygen saturation is a little bit different. So, and this decrease is above sea level and with increasing age. Okay, so it can be a little bit different at sea level. Wow, look at that, huh? Okay, now our next slide. Do we need to know base excess? Not sure what you mean. So
yeah, the last slide had a plus or minus 2 for the base excess. I was wondering if that's something we needed to know.
Plus
the very
or minus.
bottom.
This one? Yeah, no, nothing with that. Don't worry about that. Okay.
Okay.
So yeah, no problem. I'm glad you're asking questions. I want you to understand it. The book says 3 through. Yeah, don't worry about that. But I'm not concerned with that. We're not going to ask you about, different areas. I just want you, I'm happy if you can just get the basics down. Okay, so our oxygen, partial pressure of arterial oxygen, it reflects the adequacy of oxygenation of the plasma. Approximately 2% of oxygen is carried in plasma. Remember, it's carried in the hemoglobin, right? Oxygen attaches to the hemoglobin, it's carried around to the body. Hypoxemia, emia, blood, is deficiency of oxygen in the blood. So if someone is hypoxic or hypoxemia, they have a deficiency of oxygen in the blood. So 70 to 75%, this is our PaO2 we're talking here. So this is for arterial blood gases. This is our PaO2 80 to 100. You might be saying, wait a minute, O2 sat, if somebody's below 92%, that's abnormal. That is O2 sat. That's different. This is in the artery. This is much more reflective. We take O2 sat, we're like, they're going down to 70s. Now we need to get more specific and learn a little more. Just on the outside in the finger, that's a quick, estimate of how they're doing. But if they're not doing well, we need to really know what's going on. Then the patient needs to get some ABGs. And then we're going to be looking at the 70 to 79, mild hypoxemia, 60 to 69 is moderate hypoxemia. And if it's less in the 50s, that is not good at all. Okay. But you're only going to get these results, the 80 to 100, from arterial oxygen levels. Okay. So don't confuse that. It's different than O2 sat.
So you would only get that done if a patient is like really critically ill then?
Right. Exactly. Okay, let's talk about some examples now, and let's talk about respiratory acidosis. So what is respiratory acidosis? I remember arterial, okay, CO2 35 to 45. That's normal, okay, right? We talked about that. So here our patient is sleeping, and what's happening to him? He's not breathing. He doesn't look like he's breathing too well. He's getting an increase. He's underbreathing. He's getting too much acid. Capnia, acid, okay? High levels of acid, okay? So what's going to start happening to him? He's going to be underbreathing, right? And what happens when he underbreathes? can build up. He's not building up oxygen. What's he building up? CO2. He's building up acids. Because why is he building up acids? Because when we breathe, right now, I'm getting rid of what? CO2. He's not getting rid of it. He's not getting rid of that CO2. It's not coming out. Like normal people breathing are, 16 to 20. We are getting rid of CO2 at a normal rate, at a normal level, to keep that acid CO2 level in check. So his respirations are very shallow, so he is going to build up CO2. What do you think we're going to do to get him to get rid of that CO2? Cough, get him up. Yeah, wake him up. Shake him.
Breathe deep.
Get him to breathe deep. Sit him up. Come on. Come on. Wake up for me. Give me some nice deep breaths. Right? Yes, that is right. That's what we're going to do. Okay. Face slap. Okay. I don't know that I'd slap a patient in the face. Okay. I know you're joking. Okay. So what are the causes of this happening? Of respiratory acidosis, diseases of the airways. So you've got your asthma patients, your COPD patients, pulmonary edema, pneumonia patients. They're all at risk of acidosis, multiple sclerosis, stroke. What about an increase in respiratory rate? What about it? We want them to get up, but we want them to wake up and get up there with their respiratory rate. Because chances are that guy, he's sleeping, he has a respiratory rate that is much lower. Now we're going to talk about if they increase it too much and what can happen, as Logan just answered. Yes. So yes, this is emphysema patients, COPD. They are at risk of acidosis. They are at risk of not getting rid of that CO2. Okay, drugs that suppress the breathing, such as opioids or alcohol. And that's why I think, as Megan said, what are we going to do if we can't get them to cough turn or get them up? Not so much turn, but just get them. The first thing you want to do is get them to breathe. Get them to breathe. Come on, take some nice deep breaths for me. And if they're unresponsive, then we go to the Narcan, the naloxone. Obstructive sleep apnea. Okay, these are your patients who don't breathe for seconds at a time. I think most of you know about, probably from maybe friends or relatives, or maybe you have sleep apnea. So condition of sleep apnea, they're not breathing. They go for long periods of apnea. And when they have those long periods, they are not getting rid of the normal levels of CO2 that we do when we are awake and we breathe normally. So what are the symptoms? They can get a headache. They can feel warm, flushed. Their pulse can start to go up because it's going to start compensating. All right. They can have blurred vision. Eventually their blood pressure is going to go down. They're going to be irritable. They can start to have altered mental status. So does the C basically push air? I'm not sure what you meant by that one. They're going to get drowsy. Yes, they're going to start to feel drowsy. It can affect their level of consciousness. This is as it continues on, and they're going to get confused. They can go into cardiac arrest, and you may not be able to wake them up. So what do? We treat the underlying cause. If it's drugs, if it's too much drugs, and it can be too much pain medicine, then we are going to give them naloxone. If it's just they've just been sleeping too much, we're going to treat the cause. We're going to shake them up. We want to be watching their rate and their depth and seeing how they're doing. We're going to listen to their lungs. We're going to assess their level of consciousness. Are you with me, Mr. Jones? How you doing? Tell me where you are. Tell me your name. Check their orientation. What's your name? Tell me your name. I mean, they may not know where they are, but at least they might know, hopefully, their name. So see, if they can't even respond, that's concerning. Sit them up. We always breathe better when we sit up. Someone who's having trouble breathing, COPD patients, they sit like this. They sit with their arms on the side of the night table, okay? Because they can't breathe. Or they sit in a chair. How many of them sleep in a chair, right? Because they can't lay down and breathe. So sit them up. Encourage the patient in chronic respiratory acidosis to use pursed lip breathing, controlled. Okay, administer naloxone, and we might have to put them on CPAP. Would you use oxygen? Yeah, they might need oxygen too. Yes. Okay, now let's talk about the opposite, respiratory alkalosis. This is a condition, now remember what's normal. This is a condition where they're overbreathing. And so what's happening, they're hyperventilating, they're getting rid of too much CO2, right? They're going, if we kept that up, what would happen to us if we kept that up for like 10 minutes? We'd faint and we'd pass out, right? Okay, we would faint and pass out. Why? Because we're getting rid of too much. Too much CO2 is coming out of us, I should say, right? Got too much CO2 being released. So our body is going to become basic, alkaline, alkalosis. That's from overbreathing. So what do you think we're going to do to help with this situation? Yeah, your fingers and toes are going to become tingly. Absolutely. What are we going to do with this patient? Relax them. Paper bag. Or if you don't, what if you don't have a paper bag? I don't have a paper bag right here. Use your hands. Because I'm trying to capture all that CO2 that's going out into my room. I'm holding it in so that I can breathe it back in. I'm getting rid of tons of it. Right? Yeah, pursed lips. What's the point of pursed lips breathing? Why do we want to always encourage that? What does that do? Pursed lips. Slows and controlled. It controls the breathing. Good. It's much more controlled. Because if you might have to say, look at me, breathe with me. In and the other one, go, no. Follow, look at my lips. Breathe with me. It's keeping them from doing the, and they're getting rid of all that CO2. So in a scenario, a test question, you all want to know about test questions. If there is a scenario where someone is hyperventilating, picture them doing that. What are they doing? They are getting rid of CO2. So what is left? How's the scale tipped? High in alkaline, high in basics, right? So they're alkalosis, right? If they're alkalosis, we got to get more CO2 into them. What do we want to get them to do? Breathe into their hands, cup their hands, and save that CO2 that's going out into the air and give it back to them. Okay? Paper bag if you have it. Yeah, absolutely. Monitor electrolytes. Yes. Calcium, potassium. Calcium is very much like an acid. When you think of potassium, we're going to talk about that. Would you use a non-rebreather? We don't really go get the I wouldn't attach it to the oxygen. Really, all you need to do for someone who's having a panic attack, hyperventilating, is get them to breathe into their hand and get them a paper bag. Just get them something where you're holding on to that CO2 so they can breathe it in. Yeah, anxiety medications might be needed if you really can't control their breathing, but that's going to take a couple minutes to work. Whereas this is breathe into your hand. Breathe into your hand. And sometimes you're distracting them too. Now, I remember, you know how when you guys take your exams, you all remember, especially if you're A to M or whatever you are, you're in F102. So a couple of years ago when I was teaching this and we were on campus, I worked with a doctor who used the non-rebreather on a patient. Because the non-rebreather is a panic attack, but I would guess did he attach it to oxygen? You can, or, you just want that bag. It also depends on how bad they are. Whoever asked that question. Yeah. So no, right. There you go. Because what he used was the bag. He didn't have a paper bag. So he probably went, an N95 mask would be perfect. Anything that's going to keep the oxygen in. Okay. And keep that CO2. We want them to keep the CO2 in. So anyway, I went down into the classroom. It was exam day. And we had just done ABGs. And so one of the classmates said, she just graduated, I think this past May. And she said to me, Professor Mobilio, I am in a state of respiratory alkalosis because she was so nervous and hyperventilating over the exam. So, right. I know. Cute. Okay. So we talked about what we're going to get them to breathe. So I want to allow a little more time for us to do some examples. So respiratory alkalosis, anxiety. People who get very anxious, they start hyperventilating, they can't calm down. Brainstem injury patients can also affect the amount of CO2 that they're excreting. Fever. Okay, your body is working with a fever. Think about a fever. What's happening with a fever? Your body is flush, it's working harder. If you're hypoxic, you don't have enough oxygen, you can also become, your respiratory rate goes up and all that. And because your respiratory rate is going to go up because your body's trying to compensate for the hypoxia. Increased basal metabolic rate. And I mentioned, you don't have to know about the vents. If you're over ventilated, there's levels if they're not set right. Okay. And then the aspirin and salicylate intoxication. So when I think of salicylic acid, I think of it as an acid. And sometimes if there's too much, like this, early symptoms, but if there's too much of that, I'm not going to ask you about that, by the way, because the book, if you look at it, some of these things are in both categories. So don't get confused with that. Aspirin toxicity, yes, that's your salicylic acid. And usually it's too much acid. So you are in a state of acidosis with that. But this one is the early symptoms. And that's where you can get the early toxicity, and that is alkalosis. Okay, the early versus later. Later becomes acidosis, but don't even worry about that. So what are you going to feel? You're going to get dizzy, numbness and tingling around the mouth and hands, right? Remember we talked about what happens if you keep that up. Palpitations, dyspnea, chest tightness, anxiety, panic, tetany, okay? Respiratory rate, yes, much greater than 20, yes. So this is your alkalosis. What are you going to do? You're going to monitor their vital signs, level of consciousness, ABGs, if it's so bad. Encourage the patient to breathe slower. All right, teach breathing, stress reduction techniques. Administer, maybe on the days of the exam or whenever you get anxious, just take some nice deep breaths, right? Just kind of calms you down, right? As opposed to, okay, administer a sedative. Yeah, give them some anti-anxiety meds. But the very first thing I would do would be to try to get them to control their breathing, because that's immediate. Yeah, then you can go ahead and give them a sedative to follow up, because maybe that's only temporary. And then monitor your ventilator settings, administer oxygen, maintain fluid status. Okay, now we're going to talk a little bit about metabolic acidosis. Metabolic acidosis. So metabolic, think about the bicarbonate levels. All right. So this is a situation of your HCO3. So that's what's normal, 22 to 26. Now, if it's less than 22, we've got a lot of basic on board. Nope, I didn't say that right. So if it's less than 22, we have a lot of acid on board, right? We have, as soon as I saw it, I said, wait, I didn't say that right. See, even I have to think about this. So when you think about your 22 to 26, go back to that slide that says greater than 26 is basic. Less than 22 is acid. So if you have less than, if you have a deficiency and it's less than 22, you are going to be acidic. Make sense? Hopefully. Yes, makes sense. Okay, so we're going to talk about this a little bit more. Here are conditions and causes. What can cause this? Don't worry about the non-volatile acids in the blood. Impairment, diabetes, mellitus, starvation. So you might say, okay, let's talk about diabetes first. So what happens with diabetes? What is the body producing when we have increased levels of sugar in our blood, what happens? We start to produce ketones. Exactly right. So we have increased levels of blood acids or ketones. Okay. And the body can't produce enough insulin. So the body starts to break down fat as fuel. Okay. It starts to break down the fat as fuel. And the sugar stays in the blood. So the cells don't have any sugar because it's in the blood, right? So we're building up all of this acid. So we are in a situation of metabolic acidosis. We have a lot of acids on board. So it's metabolic acidosis. So what happens with that scale? We have too much acid. We are going to decrease the bicarb. So the bicarb decreases. And this is in situations of prolonged diarrhea or use of laxatives. So, and here is your excess ingestion of acids. This is what I was talking about. So excess salicylates, they are acids. So I look at this as acids, acidosis. Now, let's talk about for a minute vomiting. When you vomiting, remember I mentioned in the beginning, what are we getting rid of? HCl, hydrochloric acid. We're getting rid of acid because it comes from the stomach, right? So this is just a way that I remembered it. If it works for you, use it. Of course, you can think of getting rid of acid as you're getting rid of the acid and vomiting. Okay, vomiting out your mouth. Okay, acid A. That's how I would always remember. Acids come out my mouth, A, and my butt is bases come out my butt. Okay, diarrhea. So if you have diarrhea, you're losing bases. If you have vomiting, you are losing, you're vomiting, you're losing acids. Okay, A, B. Okay, acids you're losing when you vomit. When you have diarrhea, you're losing bases. So that's how I always remembered diarrhea. What am I losing? Am I losing acids or bases? You're also, there are times when you could be, with some surgeries, you could be, this is a general rule. Some things sometimes can change. And it can be a little different. But as a general rule, when you have prolonged diarrhea or you using a lot of laxatives, you are losing your bases. Okay, so you're decreasing your bases. So if you lose a lot of bases, here's your bases down here. Where's your acids? Up here. You have an excess of acids and you are in the condition of metabolic acidosis. Make sense? That's why I want it to make sense so that you're not just memorizing. But I always think about, losing your acids. If you're losing your acids, what condition are you going to be left with? You're going to have an excess of acid? No, you just lost them by vomiting. Right. If you're vomiting, you're going to be in a condition of alkaline and alkalosis if you're vomiting. Okay. And that's your metabolic alkalosis. We're going to get to that. So can we talk about age and compensation? You don't really have to know much about compensation right now. The body is going to compensate. That is more next year, compensation. Okay. Don't worry about compensation. The body is going to, there's not going to be any test questions about compensation. Okay. It's basically, what is the nurse going to do? First, you want to recognize signs and symptoms. These are your test questions. I'm telling you right now. You want to recognize if someone's vomiting, what condition are they in? So think about, what are they losing? Is it metabolic? Is it respiratory? Is it acidosis? Is it alkalosis? If they're vomiting, it is metabolic acidosis. If they have diarrhea, if they have COPD, if they have DKA, those conditions, what are they in? Think about how it works. One other thing, think about your starvation diets. Okay, right up here, starvation. What happens with those starvation diets? How does that work? Whoops, sorry. I'm moving ahead too much.
Is that like a buildup of acid?
Yes, right? Because when you starve, your body starts to produce the ketones. The ketones are the acid. Yes, Nicole, vomiting is metabolic. We're going to talk about that. We haven't gotten to that one yet. Yes. So your body starts to break down the fat. You're building up the ketones. That's why, and it's hard on the kidneys. The kidneys have to try to filter out those ketones. So that's how starvation diets work. So if someone has been doing this for a long time, they can have a condition. They can, if they're not, if it's not in balance, they can build up a condition called metabolic acidosis. That's why some people are against those starvation, not so much starvation, but even those keto diets. You hear all about the keto diets. You just have to be careful and, you know, watch your symptoms, make sure that, you know, you're doing okay on those diets, because that's what it is. Your body's producing the ketones, and you are, you're breaking down the fat is what you're breaking down versus the glucose. How are we going to, I know someone who went to renal failure. Yeah. Renal failure on the ketones because it clogs the kidneys. Very hard. Intermittent fat can cause ketones. Yes. Yes. You can get a buildup of ketones when you have intermittent fasting and starvation and the keto diets and all that. So what are we going to do? We want to monitor their level of all that. Okay. Position the patient to facilitate chest expansion. Provide oral care for dry mouth. Administer IV sodium bicarb, but carefully if ordered. But this is only when a patient's levels are extremely low. We don't give that unless they're more like 7.2 or lower. Oh, I missed your question. All right, let me go into the chat and see. Lots of chat. So metabolic acidosis causes vomiting, and after they vomit, it puts them in alkalosis state. No, not correct, David. If they forget it, no, vomiting does not cause acidosis. Okay, vomiting is caused by whatever can cause vomiting, a stomach bug. It is not caused by that. Once you vomit and you continue to vomit and you continue to vomit, then you're going to lose your acids. Okay. If you vomit once, no big deal. You've got enough acids on board. You're still in that balance. But if that vomiting continues for weeks, all right, and you're continuing to vomit and vomit and vomit, then you're at risk. You lose your acids. Then you're in a situation of metabolic alkalosis. Okay, we're going to talk about that next. Yes, vomiting is a clinical manifestation. Exactly right. Exactly right. Okay. I want you to make sure you understand that. I don't want you to think that, you know, acidosis causes these things. No. What happens is something happens. You become septic, you get a fever, you get vomiting, a bowel obstruction, whatever, you're vomiting, whatever happens. That's when this can happen to you. Okay. These things don't cause all this to happen. Then you get into that state that, you know, imbalance of your arterial. That's when it starts to affect your arterial blood gases. These are usually patients, you may see them because they usually go to ICU, and then unless they catch it quickly, they can catch it quickly when they're like on the cusp of it. If you have prolonged diarrhea and you're losing bases, you're in metabolic acidosis. Exactly right, Eileen. Exactly right. Yes. If it's prolonged and it starts to happen, then you're going to, you know, oh, I'm feeling, what was that? Okay. Let's keep going because I want you to, I want you to keep going with this. All right. I got to get back to my, all right. I can see both. All right. I just switched to my chat box and not, because I've been catching the chat as you come across. All right. Let's talk about metabolic acidosis. So this is, think about the direction of the bicarb, 22 to 26. 27, 28 is excess what? Bicarb, right? 26, 27, you're going to get more basic, more alkalosis. All right. Let's talk about this one now. So how does this happen? So these conditions are all results of results of what's happening to the patient. Okay, so how does this is the cause of it. And then it puts you into this state. You see that? I want you to make sure you know this is the cause. So if you have excess acid loss, you're losing it because of the vomiting, gastric secretions, gastric suctioning, NG tubes, whatever. You can be in the state, you're losing that HCl, your hydrochloric acid from your stomach. You can be in this condition. Diuretics, potassium losing diuretics, furosemide. You lose a lot of potassium. Potassium is thought, think of potassium as an acid. And then here's some other conditions that can cause you to end up with losing acids and causing a buildup of alkalosis. Okay, buildup of your bicarbs and puts you in alkalosis, a buildup of bicarb. So elderly are especially at risk, okay, because it can often be due to fluid imbalances, like your potassium we were talking about. You want to treat the underlying cause. Young females, they self-induce vomiting, okay? They keep it going, and what are they at risk of? Metabolic alkalosis. You can get low potassium, low chloride, high levels of aldosterone. This can be caused by an excess of alkaline. Okay.
Now, is that caused because potassium and calcium and things like that are cations, and so therefore are,
I believe so,
acidic in nature?
Mm-hmm. Yes.
Okay.
They are acidic in nature. Yes. That's
Okay,
why if
thanks.
we lose a lot of those, it's all about that balance. We lose them, then we're going to have an excess of the other. We're going to have an excess of HCO3.
Thank you.
Of bicarb. Mm-hmm. Okay, I want to show you some examples of how we interpret. So pharmacotherapy, metabolic acidosis. What are we losing here? We have an well, I should start with, what do we have an excess of? Acid, right? So if we have too much acid, we need to bring the base up, right? So we want to give some bicarb, but it's only done. IV sodium bicarb, they wait till the patient gets down to like 7.2 or 7.1. Metabolic alkalosis, too much alkaline, right? Too much base. So what are we going to do? We sometimes give potassium, because remember, think of potassium as bicarb comes in tabs. So yes, it does come in tabs. So we're going to give, we could start with giving tabs here. Yes, we start by giving tabs, and then we can go to IV. Back to the alkaline. Too much alkaline, potassium, think of it as an acid. We are going to give maybe some potassium chloride, sodium chloride, going to give some, so these are going to help improve that. Hydrochloric acid or ammonia chloride. So that's more an ICU. Okay. Respiratory acidosis. If an overdose, Narcan. But first we're going to try to wake them up. And then alkalosis, they're losing too much CO2, anti-anxiety agents. So this is the pharmacological treatment of it. We don't always start with that though. Okay, how do we interpret the blood gases? This is it's not important, but first you want to interpret them and then try to figure out what's going on with them. So step one, look at the pH. Always start with the pH. It's going to tell you, you got that range, right? 7.35 to 7.45. Is it acidic or is it basic? Then go to the CO2. Where is that? Is that normal? Is that acidic? Or is that basic? Oh, wait, one thing I wanted to mention that I forgot with the alkalosis, metabolic alkalosis. I want to go back to that slide. One of the things that we do is for these patients, if they're losing too much acid, we want to give them some bicarb, right? What tablets, we talked about this earlier, what tablets might we give Yes. Sandy, you mentioned the hydrochlor, the sodium bicarb comes to combat the hydrochloric too much loss. Yes. But also Tums antacids. Exactly. See how
Wait a
that
second.
works?
Are you talking about metabolic alkalosis? Because if it's
I am.
alkalosis, you don't want to give them more bicarbs, right?
Right. I'm talking about metabolic acidosis. You got this, Ryan.
Got it. Thank you.
Right. Right. Exactly right. So you got to think about, what are we talking about? So if a patient has too much, think about what they have. If they're losing a lot of hydrochloric acid, okay, what do we want to give? Rolaids or bicarb as well? I don't know about Rolaids. I know Tums are. I think so. We want to give a base, right? And that's what you want to look at. Now think about a patient who might be taking too much, too many Tums. What do you think might happen?
Alkalosis.
Exactly. That's what you want to think about. Tums are bicarb. They're basic, right? So there's going to be too much. You want to start thinking too much bicarb. Exactly. And what are we going to do to treat that? So excess bicarb, excess Tums can cause, patient education is important with Tums. Yeah, we don't want them taking too much, okay? Because then they can go into state of alkalosis, okay? We want to be looking at that. All right, very good. Great job. So look at what the problem is. Okay, now is this next, so first we're going to start with the pH. Is it normal, acid, or basic? Is the CO2 normal, acid, or basic? And
The
then
CO2, I'm sorry, the CO2 is the PaCO2, right?
this is all it's all arterial. Yep.
Okay.
And then is the bicarb, which is also the PA. This is only, you're going to do this only when someone has this test done, arterial blood gases. Is the bicarb acid basic? And then we're going to match it. We're going to match the CO2 or the bicarb with the pH. So let's do a couple. So first I said the pH. Is this acid or basic? Basic. Awesome. So remember that we're going to put a B here. The CO2. Is this acid, normal, acid, or basic? The edge of acid, but technically it is normal. Right? The CO2 is on the edge of basic, but technically it's normal. So we got a basic and a normal. Now, 70, we don't care about that. All right, don't get confused with that. We don't care about that. Now, the bicarb, 50. What is that? Bicarb, is that basic or is that acid? It is basic. So now we are going to match the two that match. We got a B and we got a B.
Metabolic
Bicarb.
alkalosis.
You got it. Bicarb, I always said, think bicarb, think metabolic. So it's metabolic, basic, alkalosis. It gets confusing.
So would it always be that the two are going to be matching, or would you have one that's alkalosis, like acidic, and then one that's like basic?
For the most part, they're going to match. When your pH starts to become more normal and your others are out of range, that's when the body starts to compensate. Remember Ryan was asking about compensation? That's when things are going to start to compensate. We're not going to cover compensation. So that's when things are your body's going to start working. And now you know that the body's been compensating. It's getting better. Okay. So, but I first want you to understand what it is when it's not getting better and when the body's pretty sick and what these mean. And then they're going to start to come more into normal range. The body is compensating. Okay. Let's do interpretation too, because then I have an assignment and I want you guys to take a break and go over it. I mean, do it on your own and then we're going to go over it. Sorry. Okay. So pH, what is pH? Acid. Perfect. This is what you do. Now look, so put an A there. PCO2, what is that? Okay. Yeah, because it's less than 35, so it's acid. Right there, we got 2 acids. We could be done, but let's keep going. What is 18? 18 is acid.
Wait, Professor Mabili, I had a quick question. Isn't the CO2 that would be basic, not acidic, right? Because basic would be less than 35.
CO2 is basic. Right. Yep. CO2 is basic. So we have acid, basic, and this one is, what is this one?
Acid.
It's metabolic acidosis, but the CO2 is low, so it's like, was it compensation?
It's partially compensated.
Right. But don't worry about the compensation. Okay. The CO2 is low, so it's trying to compensate.
So you
what
always
you
go basic, whatever the pH is whether it's acidic or basic. And then the other
Exactly.
ones will tell you whether it's metabolic or respiratory.
Exactly. Whatever the pH is, that's when you're going to start with right there. Is it alkalosis or acidosis?
So
From the
because the
pH.
pH is acid, even if the CO2 is basic, it's still acidosis.
Say that again.
Well, the CO2 is saying it's basic, but the
Right. It
pH
does
is
not
acidic, so
match.
it's always acidic because of the pH.
It's always acidic because of the pH. And then you have to find the one that matches.
Got it.
This
Thank
is
you.
the one that matches, right? This is basic. So we have A, B, and this is B, right? This is basic. Wait, I'm sorry. This is acid. Sorry. Okay, everybody see this? I don't want to confuse you. This is acid.
This whole subject is so confusing.
No, it's not. No, it's not. No, go by the levels and go by what is, first thing I do, I
We
say,
don't see your pointer.
you don't? Oh my God, I'm pointing so much. Oh, someone
Now,
else is
now
writing
we see
today.
the A.
We see the A now.
Oh, somebody's writing in for me. Who's that? I'm not writing it. All right, let me see if I can write it. I can write. Okay. Somebody wrote a B. Okay. So we are matching these two. We are matching these. See that? Okay. So this is low. Bicarb is low. It's lower than 22, so it's acid. So it is metabolic acidosis. Exactly.
Can somebody tell me the PaO2? What's the normal value so I don't have to look through all these papers?
80 to 100 is normal.
Thank you.
But we're not concerned with that right now. So let's do number 3 because I have a whole sheet. I want to go over them with you.
Also, for the PaO2, it's mild hypoxemia. So would that be something that we should be aware of?
Yeah,
Right.
yeah,
Yeah.
you should be aware of it. Yes, you should be aware of it. Right. You should be aware of it. What those ranges mean. If it's in the 50s, bad news. Normal is 80 to 100. Yes. Okay, so let's do this one. Is this start with the pH? What is this one? Acid or basic? Basic. Okay, thank you for telling me about the pointer. Okay, now the CO2. Let's go with the CO2. What is CO2? What is the 22? It's kind of on the acid edge, right? Which two match? We know that it's alkalosis right off the bat, right? And which one matches with it? Respiratory. So respiratory, it is now respiratory alkalosis. Okay? See that? One more, and then I'm going to have you do some, and then we're going to get back together. $7.33, what are you going to think right away? PCO2? Are there a lot of acids? Remember the 35 to 45. Bicarb, 37. And we're going to match these two. So we already know, because this is pH is less than 7.35, we already know that this is acid, right? So it's going to be something acidosis. Which one matches with it? The respiratory one, the CO2. So it is respiratory acidosis. You got this.
Well,
Easy.
so basically the bicarb like value is going to tell you whether it's metabolic or respiratory.
The pH is going to tell, the bicarb is going to tell you if it's metabolic. The CO2 is going to tell you if it's respiratory. So whichever one matches.
So if the bicarb matches the pH, it's metabolic. And if the carbon dioxide matches the pH, it's respiratory.
Exactly. Okay, see that? So see this one? Right off the bat, we know it's alkaline. It's alkalosis. This is way high. It's alkalosis. This person would probably be dead. And then we're going to then look at which one matches the pH. This one is basic. It's very low, right? The CO2 normal range is 35 to 45. So this is lacking acids. Remember, CO2 is acids, so it's on the low end, so this is basic. This one is on the cusp of being acid. Does this match? No. These two match. So what are the two B's that match? Basic and basic. So this tells us right off the bat, alkalosis. This matches it, so it is respiratory. Respiratory is CO2, like I said in the very beginning. HCO3, bicarb, is metabolic. The HCO3, this is normal, yes, but it's on the acid side. So you could say that it is normal. Oh, what happened to my pointer? I got rid of my pointer. You could say that it's normal. Yes, and that means that it's, you know, that it could be starting to compensate. But you want to look at the two that match. That's the important thing. These two match. So acidosis, respiratory, because these two match. Now, look what I have for you. Number one again, sure. And then I want you to do this, and I want to come back in 10 minutes. I know I didn't give you much of a break. Let's do this one. Okay, so what is this acid or basic right off the bat? Excellent. And what is this one? Normal. It's normal. And what is this one? HCO3.
High.
Basic.
So which two match? The bicarb, this one, right? And this one is metabolic, right? And this tells us okay, so it's metabolic alkalosis. See that? Okay, so I'm going to give you 10 minutes to start these. Let's do the first one together. So right in here, I want you to write in, what is this? So it's, and I even gave you the little, so this is what I want you to memorize. Okay, you know this already. You know this whole first one already. So this whole first one is what? Acid, right? And what is this one? 35? Normal. And what is this one? 20? So what are we going to get? We know it's acidosis. So it is
Anna, can you mute your mic, please?
yeah, everybody mute their mics except me. Sorry. Okay, you see that? You see that? Okay, now no one wants to talk. Okay,
Yes.
yes. Okay, great. Okay, so do 2 to 8 and we will come back in 10 minutes. Sounds good? Sounds good. Okay. Okay, are we back?
Yes, yes.
Yes, yes.
Yes.
Okay, so you guys are starting to do this. Pretty cool. All right, so I'm going to go through them, and someone else wants to write in there. I see. That's totally fine with me. So I'll write in though. I think just to keep it more consistent here. You got my drawing out, and then I want to take questions. We have 10 more minutes. So 7.48 is what? Basic. Okay. 38. Someone's writing over me here. Okay. And the 30. So which two match? We know right off the bat that this is alkalosis, right? And the base matches. So it's metabolic alkalosis. You guys are so good. Excellent. Okay. 7.3. 50, 24. What do we have? Respiratory, exactly right. Acid. Takes me a while to write this. Okay, 7.49 is 30, 24, normal. And what matches? We know that it's going to be alkalosis, respiratory elk, right? Good. You're getting the hang of this. You guys are good. Told you you'd get this. Okay, now 4.8. Basic. 4.6. Acid. 30. So it is what? Metabolic elk. Excellent. 7.3. 30. 18. And what are we going to call this? You guys are excellent. You're going to get 100 on my questions. 7.46. 46. A lot of acid there. And what is 27? And what do we have? Awesome. 7.31. 50. 22. And these two match. Oh, where's my respiratory acid? Acidosis. Okay, excellent. Does everybody see that? Who has questions about how we determine what it is? How do we interpret these?
The number 6, I was having a hard time with. I just couldn't grab the concept.
Okay, 7.3. So that is on the acid side. That is less than our 7.35, right? Anything less than 7.35 is acid. So we know it's going to be acidosis. 30. 30 is, if we look up here, I don't know if you guys, are you seeing my pointer here? We're at number 5, 30. Can you see my pointer, the hand? No.
No.
Oh my God, I have been using this the whole time today. Let me try this pointer. Oh, this is the pointer. Can you see this?
Yes.
Oh my God, I'm so sorry. I've been using the hand to point, and the hand is going over. Okay. So look up here, number 5, 30 is greater than, so it's base. Okay. The more base we have, it's really, there's a lot. This is the normal range. Less than this is less base. More is greater than this is more base. So this is going to be base.
No, it was
So
number
I thought you said
number
5.
6 because like you
Sorry.
have the pH. I get the pH and I get, but
Oh,
since
sorry.
like
I'm
the
sorry.
CO2 is basic and then like the HCO is like acidic, like I couldn't figure out which one am I picking out of the two.
So you have to pick the two that match. So if it's HCO3, it's going to be metabolic. If it's CO2, it's going to be respiratory. So these two number 6 match. So it's going to, you're always start with the pH. So you know it's acidic. It's right off the bat going to be acidosis. Then you're going to see which one matches. But go in the direction. Okay? Because this is about the more of these that you have, you're going to have more acids. The more of these you have, you're going to have more bases. Because this is basic and this is acid. So that's where it can become confusing because these are kind of an opposite. Okay? Does that help? So, okay, what questions? We have 5 minutes. Well, this is what I want you to know for the test. Okay, I know you all want to know. Right? Okay, now you're going to be quiet and you're going to be listening to me now, right? Okay, so what you need to know for the test is yes, you have to know how to do this. You have to have these numbers memorized. We're not going to give you what they are, what the normal ranges are. So I think you have them pretty much memorized right now. And you're going to have to do this. So that's what you're going to do. You're going to say, this is acidic, this is basic, or whatever, acidic, normal, neutral, whatever. And then there's probably one question where you're going to have to interpret it. But the rest of the questions are not just this. The rest of the questions are going to be things like, what condition might you expect them to be in if they're vomiting, if they're hyperventilating, if they have diarrhea? And then the other part is going to be what is the nurse going to do? The interventions. And that is pretty much what most of it is all about. Okay? For your test questions. So if you know those basic things, you know, because first you're going to have to interpret it. You're going to have to know if the CO2 is up, that means the patient has a lot of what on board? Acids. Right. Exactly right. So if you see a question like that and if I give you the acid, I'm going to give you the number and you're going to have to say, oh, this is like, 40 or 50, not 40. This is 50. That means they have a lot. Or I give you a number of HCO3 of 28. You're going to know there's a lot of base on board. Okay. And you're going to know that that's metabolic. So you're going to be thinking along that line. You want to know the interventions for someone who might be in one of these situations. Do we need to know all the clinical manifestations? No, you do not. No, you do not. No, you're just going to I basically covered most of what you need to know. What are the basic ones? And what are you going to do? Are you going to have them take deep breaths? You're going to have them breathe into a bag? What condition might cause metabolic alkalosis? What is something, that you want to be thinking about? When you think of potassium, think of acid.
Professor.
Not really sure, Giovanni. I think there's going to be we're going to give you the blueprint. We actually haven't done it yet. We're going to do it after this at our meeting at noon. We have a noon meeting on Tuesday, so probably going to work it out. Probably you can expect 8 or 9 questions on acid base. So, things like that's pretty much it. What are you going to prepare to administer? If a person is hyperventilating, what might you expect the pH to be? Or this, or something like that. Okay. So that's pretty much the interventions, nurses taking care of clients with these conditions.
Professor, I had a question again about the vomiting.
Mhm. Yes.
So with metabolic alkalosis, that's due to excessive acid loss from like vomiting. But the manifestation in acidosis, is that more like acute vomiting? Like that's due to a buildup of the acid?
So say the second part again, the manifestation.
So the metabolic alkalosis is due to someone excessively vomiting over a long period. But
Right.
then when they have a manifestation, when they have the acidosis, is that because there's just too much acid in their body? So it's an acute vomit?
Right.
Oh, okay.
They're-
So
they might not be vomiting. If someone has too much acid on board, then
that's
you
why I
want to
was
look at.
confused earlier about the vomiting. I was just not sure.
So vomiting. So this is what they're the opposites. If someone is vomiting, they are losing. Oh, exams are supposed to be on. I don't know about that, but one thing I want to tell you before I'm gonna stay and answer this question. You know what? Some of those Pearson questions at the end that I've posted are not accurate. So I almost want to say, don't even bother doing them. Just go through the chapter, go through my PowerPoint. Some of that is totally off. Ryan called it to my attention this morning. So I don't do those. And some, yeah. So getting back to the vomiting, I studied those so hard last exam. I know. And, I'm telling you, go over this stuff today. Go over my information today. And, okay, you're wondering that too, Ryan, nausea and vomiting under clinical manifestations of, I know, you know what? And that, I saw that it's under there. So this is what you want to know. When you want to know that when you vomit, you lose hydrochloric acid. You're losing acids. You are going to be in the state of metabolic alkalosis. Okay. And then as far as clinical manifestations of, what page is that on in the book? Metabolic alkalosis.
So it seems like you have a manifestation because you built up too much acid, but then when you're vomiting way too much, then it puts you in a state of alkalosis.
Yes. That's a good way to.
That's what
a
I was
good
like
way.
asking before, but I guess it didn't come out right.
No, that's okay. That's okay.
Yeah, slide 29 on your PowerPoint shows that the vomiting and nausea is a manifestation of acidosis, which I think is what's confusing everyone.
Right.
Yeah, that's
And
confusing me
Seems like
too.
if it's more acute vomiting.
I'm not getting it.
This slide, this is from the book. This is from the page on the book.
But vomiting would cause metabolic alkalosis, and that would be a sign of metabolic alkalosis because they're vomiting. Like I would never
So-
think that somebody.
Wait. So wait a second. Nausea and vomiting is a cause of so it's a cause of alkalosis. So let me just tell you, some of the nausea and vomiting, how do I say this? You can have nausea and vomiting and might not be the main, you might not be getting excessive amount. You're not saying excessive amounts here. You can have metabolic acidosis and you can have some nausea and vomiting. It doesn't mean that you are losing so much that you're in that state. Do you know what I'm saying? Does that make sense? Not really, huh?
Yes, no, I totally get that. It basically means that nausea
Yeah.
and vomiting can cause alkalosis, but if you
Right.
have acidosis, it may cause a little bit of nausea or vomiting.
Okay.
Right. You can have it.
That's
You
what I
can
was
have that. Right. Exactly.
So it will only concern if it's like a continuous vomiting. If the question would say something like,
Right.
"Oh, the patient
Right.
continues to vomit in a matter
Right.
of such and such time, what is it leading to?" Then that's will
Right.
be metabolic alkalosis. But then if the question says something like, the patient's experiencing vomiting,
Right.
what does that indicate? Or like we would put
Yep.
metabolic acidosis.
Yeah. So when you think of nausea and vomiting, don't even think about acidosis. Okay. I'll be honest with you. Anything related to, if they've been vomiting excessively for long periods of time, they are going to be in a state of alkalosis. Someone who has metabolic acidosis is a person who comes in DKA, and it can just cause them to vomit. It doesn't mean that they have lost their hydrochloric acid. Do you know what I'm saying? If they continued, then they would be in the state of alkalosis. Does that make
So-
sense?
So it seems like a crucial factor is just the amount of time that they have been throwing up, like the length of it.
Exactly.
Okay.
So, I mean, after a while, when you're in DKA, you can just you just feeling so miserable that you just, you can kind of have lots of symptoms, not necessarily the cause of it. So the cause of alkalosis, if you are just vomiting, or you're also not just vomiting, but you're also taking in too much, you're eating those Tums like candy, right? You're going to be in a state of, you got too much alkaline on board. You're going to be a state of alkalosis. Does that make sense? But when you think of nausea and vomiting, think of alkalosis, metabolic alkalosis. Okay? Okay. Any other questions? Okay.
I
Bye,
have a
everyone.
question regarding the well elder assignment. I posted something and no one said anything yet.
Oh, I
is,
thought I saw something. Yeah.
is it a summary, an APA paper? I'm not sure exactly what type
It
of
is
assignment
not.
it is.
No, just answer the questions. It does not have to be an APA format. No, it is not a paper. It is a summary. I think there's a little thing at the end you have to summarize. That is going to be just write, write in complete sentences, but it does not